So, what do you guys think this is? These are the marbles, and what I'll show you in this case is the marbles which are seen in MRI shoulder. So, this is a scan of a 50-year-old lady who had been presenting with chronic increasing swelling and severe pain in her right shoulder. So, what we are seeing is a coronal medic images. So, medic images are a type of GR images which help us see the calcifications or ossifications better. What we are seeing this in the anterior aspect. So, this is the internally rotated hand position of the humerus. So that's why we are seeing the biceps tendon so anteriorly. What we are seeing this anteriorly is this marble like large chunk of blooming. So what does this blooming suggest? See, I'll show you once again on the axial PDFS images and see this how jet black this is. So this is nothing but the calcification. So this is a type of calcific tendinitis. So this calcific tendinitis is, however, not the routine type that we see. This is a severe thing. We have got big chunky calcifications. So based on the type of calcifications, based on the area, based on the region where it is, there would be various type of symptoms. Sometimes it is very tiny. Sometimes it can be some 2 or 3 in size. But however, when it goes under some amount of liquefaction, so when this liquefaction happens, some amount of calcification goes around in the surrounding region, and this is the reason for the pain. Sometimes this may go inside the bone, sometimes it may go inside the tendon, sometimes it may go into the bursa. And so in our case we are seeing this subscapularis tendon, a large chunky calcification, floating type of calcification which is continuous with each other, is seen in this region. Now I'll show you what is the cause of the pain in this lady. So we are seeing that this is the insertional fibers. There is severe pain. So the patient has tried to put her arm in the position where she is experiencing the least pain. So that's why we are seeing it's an internally rotated humerus. So this, as we go from up and we go down, this is the coracoid process, and as we go down, this would be the first or the superior most fibers of the subscapularis. But we are seeing that in the inferior aspect of the tendons there is this chunky calcification, and this is within the tendon itself and extending medially up to the myotendinous junction. So some of this calcification is within the tendon, some is within the myotendinous junction, and this two large chunky calcification are seen protruding outside. So what is this space? As we move from superiorly, we see that the first, just below the coracoid process, is the subcoracoid bursa, and as we move inferiorly we get the subscapularis recess. So whenever the calcification goes out or is extruded into this recess, it appears like for the recess it appears to be as a foreign body, and it elicits a significant huge amount of reaction within. So this is everything that is reactive. So this bursa or the recess is reacting to the calcification which is going inside it. So this is the subcoracoid bursa wherein the fluid is going and the calcification is going, and this is the subscapularis recess. There is, however, some difference between the nomenclature, but the generally accepted terminology is the subscapularis recess and the subcoracoid bursa. So we are seeing this significant inflammation in this region surrounding the extruded calcification, and this is the reason why she is presenting with her pain. So there are three types of calcification that we mentioned on ultrasound. One type 2 and type 3. So type 1 is liquefied, almost fluid like. Type 2 would be semi fluid like. Some areas of liquefaction or softening is there, and type 3 is totally a hard ossification. So this appears like a big chunk of ossification on MRI. However, we need to see whether we are able to see any softening within it. Sometimes we are not able to appreciate it better on an MRI and is seen better, definitely better on ultrasound. And the method of relieving the pain in this region is either barbotage, or either we do dry needling and try and break down this calcification and the products. But first we need to see how much softening is there. Sometimes this may appear like a huge chunk of calcification, but it may not be so on the ultrasound or on the x-rays. It would be a soft type of calcification. So this depends on the type of calcification. If it is soft enough, we can do barbotage and do relief or justice to this patient. But sometimes, and most of the times, this is a self-limiting condition, and the patient may get better on her own. And so the first line of treatment in this case is would be NSAIDs, and try and give some, if we are not able to extract this using USG guided things, we'll first try and put some steroid or some NSAIDs within the recess and the bursa, so that the reaction which is occurring reduces down, and then we'll see what we can do. And if the pain is so severe that even after steroid or the injection of NSAIDs the patient is not having any relief, then we'll have to go in surgically and try and remove this. So this is nothing but a mineralizing type of tendinopathy or a calcific tendinopathy, wherein the calcifications have extruded out, and this has led to a significant reaction in the surrounding recesses and the bursa, which is causing the pain in this lady. Thank you.